Hi everybody, this is a week 4 soap note YouTube video presentation. This is the ID is the SJ with the 7-year-old African American female who presents to the clinic accompanied by her father. Her father is a reliable historian and he describes a problem including redness in the white of the eyes, itchiness, increased tearing and yellowish discharge which is common after sleeping. The chief complaint is that he said that my daughter's eyes has been red and itchy for 2 days, and he said he have noticed increased tearing, thick yellowish discharge in the morning or after she takes a nap. Sometimes she complains of feeling small particles in the eyes, like a burning sensation. And he said, as you can see, she has swollen eyelids, probably because of excessive rubbing and irritation. Constant rubbing also caused her to have a blurry vision and constant tearing. History of present illness. SG is a 7-year-old female who presents with bilateral red itchy eye for the past 2 days. The eye has been producing thick yellowish discharge. She complains of a gritty feeling in one eye or sometimes in both eyes, which causes her to keep rubbing her eyes. Constant rubbing the eyes lead to the increased tearing and blurred vision and swollen eyelid. She also reports some discomfort but denies any pain. The father reports the Visine Red comfort the eyes, those eye drops, and fast remedy for red eyes. However, eye drops offered partial relief and gritty feeling persisted, causing the patient to keep rubbing her eyes. The father confirms that a family had taken a short vacation and there was a possibility of exposure to the individual with possible eye infection. The past medical history is unremarkable. There was no reported prior eye infections or vision impairment issues, and the patient has not had any prior surgical problems or surgical history. Allergies wise, patient has no known drug allergies or environmental related allergies, and SG has no food allergies, and she also denies any seasonal allergies. Medication wise, she only took Visine Red Comfort eye drops. Her vaccinations are up to date. Her social history: SJ lives with the parents and attends a local elementary school. She also has an older brother, aged 12 years old. There is no recent sick contact in the family, and however, recent vacation might have exposed her to a potential pathogens in a population. Family history: the current family history is non-contributory to the present illness. No family member has an eye conditions or any allergies. If we talk about review of system, generally looking at the patient, she has no changes in weight, no reported fatigue or weakness, and there's a general appearance is good, no fever, no headache. Eye-wise, their exam was positive for redness, itchiness, yellowish greenish discharge. There was no corneal involvement or remainder of the eye was normal. If we look at the ear, nose, mouth and throat, negative for ear pain or any sore throat or any systemic symptoms. Cardiovascular was normal, regular heart rate and rhythm, no murmurs. Pulmonary clear breath sounds on auscultation, no wheezing, no bleeding from the sputum, no dyspnea, no rails. Neurologically, normal mental status, uh, cranial nerves are intact and sensory exam is normal. Lymph node denies any swelling or any pain in the lymph nodes. Allergy or immunologically, patient denies any seasonal or environmental allergies. If we talk about her vital signs, her temperature was 98.6 degree Fahrenheit, heart rate 88 beats per minute, respiratory rate is 20 breaths per minute, blood pressure was 110 over 77 mmHg. Her skin looks normal, there's no lesions, no redness. Pinna ear, if we talk about head, is normal cephalic. Ear Penis clear, no exudate noted, tympanic membrane is intact. Eyes bilateral conjunctival injection and edema. A moderate thick yellowish greenish discharge from the eyes. There's redness and irritation to the eye. There's some swelling around the eyes, but no corneal abrasion or foreign bodies noted. And neurologically, no neurological deficits were noted. Cardiovascular, there's typical heart rate, regular rate and rhythm. Respiratory wise, clear bilaterally. So when we do the assessment, we came to the differential diagnosis of bacterial conjunctivitis or viral conjunctivitis or allergic conjunctivitis. Bacterial conjunctivitis is the first possible diagnosis, typically caused by Staphylococcus or Streptococcus. Bacterial conjunctivitis is characterized by redness in the white of the eye or the inner eyelid, increased tearing, itchiness, and discomfort. And viral conjunctivitis is another possible diagnosis that can be considered for this patient, which is caused by the viruses like adenovirus. The adenovirus is the same one that causes the common cold. So symptoms are associated with viral conjunctivitis include redness of the eye, itchiness and swelling of the eyelid, sensitivity to the light and watery discharge. And then next one is allergic conjunctivitis. The third possible diagnosis for the SJ's condition can be the allergic conjunctivitis. Allergic conjunctivitis is caused by the allergies like dust mites, molds, pollens, and pet danders. Those can cause the irritation, burning, and itchiness, red, swollen eyes, watery eyes. So, from the diagnosis and rationale, we came into the conclusion of bacterial conjunctivitis. That's the main diagnosis because it's a possible candidate in this patient's condition because all the symptoms and signs characterize the condition of bacterial conjunctivitis. A close assessment indicates the SJ has some signs associated with viral conjunctivitis like redness, itchiness, and swollen eyelid. However, there is a tangible difference in discharge and the light sensitivity, which makes the viral conjunctivitis a less likely diagnosis. For the plan wise, there is treatment options. We can do the eye drops, the antibiotic drops topically, like erythromycin and polymyxin B phosphate. Try methoprin 4 times a day for 7 to 10 days. Worm complex to the eyes for 2 to 3 times to loosen the discharge. And we need to provide the education to the patient that it is very crucial to complete the entire course of the antibiotic eye drops. And it is best to avoid the contact with the other eyes to avoid the infection. Proper hand hygiene and eye hygiene to prevent the spread of the infection. And we can have them follow up for re-evaluation in 3 to 5 days if no improvement, and we can refer to the ophthalmology if condition worsens or doesn't resolve with the treatment. Thank you.